Obesity is a major crisis that affects millions of people across the United States, and it's an issue that's projected to only get worse over time. The Centers for Disease Control and Prevention estimates that over 40% of adults in the U.S. are obese, which is 4 out of every 10 adults. It is clear that this is a problem that is affecting many Americans and needs to be addressed.
Obesity Projections finds that if we don't improve our lifestyles over the next 20 years, obesity rates in adults could climb to 44% across the nation.
Obesity rates looked in 2012. They range from low to moderate, with no states having an obesity rate above 35%. Now fast forward 10 years and the rates skyrocket above 35%. It's worse in Oklahoma, Louisiana, and West Virginia, where more than 40% of adults are considered obese.
For those that argue obesity is just an opinion of looks and fat shaming, obesity is more than just aesthetics. It is a serious health risk that increases the likelihood of developing conditions such as heart disease, hypertension, stroke, type 2 diabetes, liver and gallbladder disease, infertility, joint problems, sleep apnea, and even certain types of cancer.
Staying a healthy weight as you age may be a matter of life and death. New research in the Annals of Internal Medicine finds being overweight or obese increased the risk of death from heart disease, cancer, and more.
These findings suggest that maintaining a normal weight across the life course can substantially reduce your risks of dying. Findings suggest that the lowest risk of death is in the normal weight range, which includes BMIs between 18.5 and 24.9.
To further support how obesity presents a problem for Americans, let's talk about the costs of healthcare. The statistics are staggering, with obesity-related medical expenses estimated to be over $150 billion annually in the U.S. According to the Obesity Action Coalition, the obesity rate in the U.S. could reach 50% by 2030, which is a truly alarming prospect.
The costs are enormous in terms of the percentage of our healthcare budget.
According to the CDC, in 2019, obesity-related medical care costs in the U.S. reached $173 billion a year.
Join us in this eye-opening video, as we're going to take a closer look at the fattest states in America for 2024 and explore what's driving these alarming trends. Discover which states have the highest obesity rates and what factors contribute to these rankings. We'll explore the health implications, lifestyle habits, and socioeconomic factors that play a role in these statistics. Stick around to the end of this video to see where your state stands and which one is the fattest state in the nation. This video is packed with valuable information. Before we proceed, do us a favor and don't forget to like, comment, and subscribe for more content like this. It takes 2 seconds of your time and really helps support the channel. Hit the notification bell to stay updated on our latest uploads. Coming in at number 10 is Kentucky, with an adult obesity rate of nearly 38%. Over 44% of Kentucky's population lives in rural areas, and these rural communities face significant obstacles when it comes to accessing healthy food, as most of the infrastructure is centered around fast foods and other unhealthy options. Lack of exercise opportunities plays a major factor, and according to this article by Kentucky.com, a recent CDC study found Kentucky to be the second least physically active state in the country. 32.5% of Kentuckians, or practically a third of the state's population, does not do any sort of physical activity unless it is work-related. The combination of lack of physical activity and an unhealthy diet has led Kentucky to be the state that starts off this list.
Kentucky is one of 22 states facing an obesity problem. The Centers for Disease Control say 35% or more adults in the Bluegrass State are obese.
The rate of adults in Knox County who have been diagnosed with diabetes has been rising steadily since 2005.
Next up at number 9 is Delaware, with statistics straight from Delaware.gov that as of 2022, nearly 38% of the state's adult population reported as being obese, while another 34% reported as overweight. There's no denying that diet is the one that plays the biggest role. The widespread availability of high-calorie, high-fat foods, combined with a cultural emphasis on convenience and speed, has led to people consuming far more calories than they need. And it's not just diet. A lack of physical activity, paired with increasingly sedentary lifestyles, is also taking a toll on the state's collective health.
Says Delaware's obesity rate is 29.7%, which is up 17% since 2000. Louisiana has the highest obesity rate at 36.2%, while Colorado has the lowest at 20.2%. The most common health issues for obese Delawareans are diabetes, high blood pressure, and heart disease.
In 8th place, we have Indiana. The Hoosier state has an obesity rate of 37.9%. According to this study by the Indiana Department of Health back in 2021, the statistics are getting worse, as 69% of adults are overweight or obese, which is about 2/3 of the adult population. Note this article was written back in 2021 where Indiana was ranked 12th of the most obese states, but 2 years later they come in at number 8. Factors driving the increasing obesity trends can be attributed to this poll that was taken in 2021. 89% of adults do not eat the recommended amount of fruits, while 91% did not consume the recommended amount of vegetables. Up to 83% of adults do not get the recommended national guideline of 150 minutes of physical activity per week. According to an article by the Richard Fairbanks Foundation, other contributing factors are income, employment, upbringing, stress, race, gender, and also the environment in where people live, work, learn, and play.
Indiana is topping the charts, but not in a good way.
A new study says we are the 8th fattest state in the country.
The 8th fattest state. And everyone has their reasons for why.
There's nothing else to do in Indiana but eat.
A lot of fast food.
With all the corn you grow here.
All the starches we grow in Indiana.
The reasons include a person's level of education and income.
At number 7, we have Alabama, with an adult obesity rate of over 38%. Alabama's struggles with obesity are closely tied to its high rates of poverty, crime, and unemployment. Also, cultural emphasis plays a factor as the traditional Southern diet focuses on high-calorie, high-fat foods including fried foods. Alabama also has a large rural population, which may hinder easy access to healthier, more nutritious foods, as well as gyms and fitness centers. According to this chart from the Alabama Center of Health Statistics, white males had the highest percent for being overweight, while African American males had the highest percentage for obesity. Number 6, Ohio, with an obesity rate of 38%. There are many factors on what is spearheading this spike. According to Dr. Shane Jeffers from Mount Carmel Hospital, poverty is one of the main culprits. If Ohioans are struggling to make ends meet, it is more difficult to prioritize money and time for healthy eating, healthy groceries, and exercise. Most of their salary money would be simply spent paying rent, instead on focusing on living a healthier lifestyle.
40% is socioeconomic factors like your job status and income.
According to the CDC, 38% of Ohioans have a BMI of over 30 and are considered to be obese.
In 2022, Ohio's poverty rate was 13.4%, which is slightly above the national rate of 13.1% and increased from the first time in years, in 2021. It seems that poverty rates and obese rates go hand in hand. When poverty rates increase, it is just inevitable that an increase in obesity will follow. At the halfway point, with number 5, we have Tennessee with an adult obesity rate of over 39%. Tennessee's obesity rates are closely tied to its high rates of poverty and lack of access to healthy food options. With the state being known for its top-notch barbecue, along with being in the South, where the Southern cuisine is known for deep-fried foods. Another driving factor that must not be overlooked is the weather in the South, which tends to be a hot climate. This makes people less inclined to go for a walk or get much-needed exercise when it is hot out.
Volunteer state is among the worst for chronic behavior-related diseases, with 69% of Tennesseans reportedly overweight.
The trend line for health in the state over the last 20 years really has been not in a good direction. We've seen the rates of obesity continue to climb. We've seen the rates of sedentary behavior, people not being active, continue to go up.
Next up at number 4 is Mississippi, with an adult obesity rate at nearly 40%. Mississippi faces significant challenges when it comes to providing access to healthy food options and exercise opportunities, particularly in rural areas. The majority of the state is rural, which results in limited access to resources such as healthier foods, higher income jobs, fitness centers, and medical facilities. Matter of fact, Mississippi is number 2 on the list when it comes to the worst healthcare in the country. Depending on the car to get everywhere also contributes to the lack of physical activity. Mississippi is also riddled in poverty as they have the country's least educated workforce. Lack of industrial and manufacturing companies has also resulted in less opportunities for work. In third place, we have Louisiana, with an adult obesity rate of over 40%. Louisiana's obesity rates are closely tied to its high rates of poverty and lack of access to healthy food options, as well as a cultural emphasis on rich, high-calorie cuisine.
By most measures, Louisiana is the unhealthiest state in the nation because of high premature death rates from cancer, heart disease, and diabetes, and most importantly, because of the way we live. Researchers say our environment, which promotes inactivity and consumption of large portions of food, is killing us.
If it is one thing we noticed on this list is what southern states share in common are fattening and high-calorie diets with a strong emphasis on fried foods. Most foods seem to be deep-fried and portions are served generously, all factors that contribute to the high obesity rate. Louisiana is also not far behind Mississippi with the fourth worst healthcare in the country. Furthermore, increased poverty decreases budgets for healthier and more nutritious foods.
When it comes to obesity, Oklahoma is one of the fattest states in the country.
Next up at second place is Oklahoma, with an adult obesity rate of nearly 41%. The Sooner State's obesity rate is rapidly increasing by the year and can be attributed to many factors. Once again, Southerners tend to have large fattening meals with deep-fried Southern foods along with easy access to high-calorie unhealthy fast food with sugary drinks but less access to healthier, more nutritious food. The lifestyle doesn't help as well as many Oklahomans rely on cars as transportation with an infrastructure that discourages walking or biking, adding to an already sedentary lifestyle. The summer in the South tends to be hot, which also further decreases physical activities outdoors. Lastly, Oklahoma also comes in at fifth place when it comes to the worst healthcare in the country. I know you were probably holding out to see which state makes number one on this list. The fattest state in America for 2024 is West Virginia, which has an adult obesity rate of nearly 42%. The state's obesity struggles are closely tied to its high rates of poverty and unemployment, which can make it difficult for people to access healthy food options and engage in regular physical activity. Two-thirds of all West Virginians live in rural communities which are usually underserved and experience social isolation and underfunded with limited resources, as highlighted in this article from WestVirginiaWatch.com. According to a recent survey, MoneyGeek found that West Virginia has the worst healthcare in the entire country. It doesn't help that West Virginia also has one of the nation's worst substance abuse problems, which all contribute to the high obesity rates in the state. So, there you have it. The fattest states in America for 2024. I hope you enjoyed this dive into the rankings of the fattest states in America. It's essential to understand the broader context in which these trends are occurring. From poverty, education, and lack of access to healthy food options, to cultural diets, lifestyles, and attitudes towards exercise and nutrition, there's no single factor driving obesity but rather a complex interplay of many different elements. By understanding the factors driving these trends, we can work towards creating a healthier, happier America for everyone. What do you guys think about these rankings? Do you have any personal experiences or insights to share? Let me know in the comments below, and don't forget to check out my other videos for more insights into the world. Give us a thumbs up, subscribe and hit the bell icon for new video uploads. Until then, stay informed and Genius Tomato out.